You probably know that your emotional ups and downs can affect your relationships, right? But did you know that your mental health can also have a direct effect on your physical health, either in a positive or a negative way? I'll explain in today's episode of Ask Dr. Walt.
Today, our health includes our mind, our body, and our spirit. Separating medical facts from fiction is the key that leads to wise decisions about our health and well-being. Unpacking the latest research is vital. Doing what works helps us live our best lives today. How can we live longer? How can we live healthier? Let's ask Dr. Walt on Liftable TV.
Hi everyone, I'm family physician Dr. Walt Larimore, and I'm absolutely delighted that you're taking the time to join me today in my home office as we continue our discussion about some of the essentials of becoming highly healthy. Now, before we get going, I have to tell you that when Barb was getting me dressed, she pulled out this shirt, and I said, "That's a great looking red shirt." And she said, "That's not red, that's watermelon." So I stand corrected. So I'm glad to come to you today with my watermelon shirt. Anyway, we've begun reviewing my top 10 recommendations that will put you on a path to becoming healthier physically, emotionally, mentally, relationally, and spiritually. And we've already covered 2 of the 10 in previous programs. Now, at the end of our last program, I asked you to email me at drwalt@liftable.tv and let me know the next one you wanted me to cover. It turns out you voted for number 4 on the list, the essential of reducing stress, anxiety, and depression, what I like to call the sadnesses of mental health, so that you can lighten your emotional load and improve your mental health. At the end of today's program, I'll tell you how you can help me choose the topic for the next show. So far we've covered the essential of true health. Number 2, the essential of self-care. Today we're going to cover the essential of reducing sadnesses like stress, anxiety, and depression. And future programs that you'll be able to choose include the essential of forgiveness, the essential of relationships, the essential of spiritual well-being, of a positive self-image, of discovering your destiny, of personal responsibility and empowerment, and the essential of teamwork in healthcare. Now, here are some of your questions about sadnesses that you sent in that I'll answer today. So Gladys in Greenwich, Connecticut said, can stress be normal? That's a good question. Luke from Laramie, Wyoming says, it seems that people I know are having more anxiety and depression than ever before. Did the pandemic make things worse than normal? Molly from Marinette, Wisconsin, I've suffered from lifelong depression. My pastor says it's spiritual. My counselor told me it's psychological. My family doctor says it's chemical or biologic. Who the heck is right? Great question. Mark from Chicago, Illinois. I've had long-term anxiety and depression. Counseling's been recommended, so is medication. Which should I consider? We'll get to that. Then Sherry from Los Angeles. How can I determine if my stress, anxiety, and moods are normal without spending an arm and a leg? Are there any internet sites that you might recommend? These are great questions, and I'll try to answer them during our time together. Now, stress, anxiety, and depression under the umbrella of what I like to call sadness, SAD, stress, anxiety, depression. They're everywhere, and at one time or another, they've affected all of us. The most recent annual measure by Gallup of its Negative Experience Index, which annually tracks people's experiences, reported that stress, anxiety, and depression, overall unhappiness, is at an unprecedented all-time high and made much worse by the pandemic of 2020. Now, we can all have one or more of these negative emotions to some degree, most every day. But when one or more of them grow too heavy, they weigh us down, they begin to have surprisingly negative effects, not only on our emotional health, but also on our physical health, our relationships, and even our spiritual health. So to lighten your load for the difficult journey of life, I want to examine each one and show you how to evaluate your level of each. So number 1, evaluating stress. Now, you know stress is unavoidable. In one Gallup survey, about 8 in 10 Americans say they frequently or sometimes encounter stress in their daily lives. I can't tell you how many of my patients have told me that they feel as if they're running about as fast as they can on a hamster wheel of life. Nearly every one of my patients reports feeling super stressed. So for the purposes of this program, I'll define stress as any change that requires you to adapt or to change the way you're doing something. Stress, it can come from big things: retirement, job change, pregnancy, a new grandbaby, moving, the loss of a loved one, maybe going to a new school or beginning a new job. But stress can also come from little things: surprise change in a schedule, a change in weather, a flat tire, traffic jam, sudden deadline in your health, maybe misplaced keys or an electric outage. These events are stressors. And I'll use the words stress and stressors to mean the same thing. Now, as I've said, some stress is good. And eustress, spelled E-U-S-T-R-E-S, eustress is normal stress. That's beneficial. It's good stress. Distress refers to harmful stress. We're designed to act in response to certain amounts of stress. It can help us grow physically, emotionally, relationally, and spiritually. In the physical realm, our body is in a constant flux. For example, our bones are constantly being dissolved and new bone being laid down. With the right amount of stress, our bones become thicker and stronger. We improve our strength and our cardiovascular fitness by means of properly apportioned eustress. In the mental and emotional realm, certain amounts of stress keep our mind and emotions healthy. And spiritually, we're constantly being tested, being stressed by our Creator. This refining, is what he calls it, is one path to improved spiritual health. My point is simple. Stress is not only normal, it's necessary. But too much stress or distress, either at one single time or for a long time, what's called chronic stress, can lead to significant weaknesses in our overall well-being. Now, most of us are created with a capacity to handle only a certain amount of stress. Our stress bucket, I like to call it. Some have small, tiny buckets, and others have larger buckets. But no matter what your capacity is for coping with stress, if there's too much stress, it will overflow. And stress that spills over can negatively affect your health. Mayo Clinic experts say stress that's left unchecked can contribute to many health problems such as high blood pressure, heart disease, obesity, and diabetes. Common effects of stress on your body include headache, muscle tension or pain, chest pain, fatigue, change in your sex drive, stomach upset, sleep problems. Too much stress will not only keep you from becoming a healthier person, but it may also prematurely kill you. A study published in the journal Heart Rhythm reported that increased stress levels associated with today's hectic lifestyles were linked to an increased likelihood of sudden cardiac arrest any time of day, any day of the week. The study's lead investigator, he's a professor of medicine and he's the medical director of the Heart Rhythm Center at the Schmidt Heart Center of Cedars-Sinai, said this, quote, "We now live in a fast-paced, always-on era that causes increased psychosocial stress and an increase in the likelihood of sudden cardiac arrest." So here's my question. What about you? Are there too many life stressors in your life? Well, you may not know until you check your stress level. It's just like you may not know if your car's oil level is getting low unless you check the dipstick. And the same is true for stress, anxiety, and depression. But by finding this out early, before the problem worsens, it's easier to prevent a major breakdown or blowout. And there are several simple, free, easy-to-use, accurate stress evaluation tools on the internet. I've listed 3 of them here on the site. We'll keep them up just for a minute. All of those little tiny URLs, you can actually put those into a website and the little stress test will come up for you. If you scored high on one of these screening tools, then reducing your daily stress will contribute to becoming healthier. For example, a study by researchers at Duke University Medical Center showed that heart patients dramatically lower their chance of having more cardiac problems by learning and utilizing stress reduction techniques. Ironically, according to the Duke researchers, only about 10 to 20% of heart patients ever wind up in these kinds of programs. There are probably a couple reasons. Sometimes insurance companies won't cover the treatment. But most importantly, it's surprisingly hard to convince patients that they have a stress problem, even after suffering a heart attack. Well, here's a few ways to reduce stress that I prescribe to my patients. Maybe one of these will work for you. Take short walks with a friend or a loved one, your spouse or kids, for just 30 minutes per day. And it doesn't have to be all at one time. It can help improve your sleep, boost your mood, reduce stress, boost your immune system. I call it taking time to kick the leaves. Here's another prescription. Take emotional health breaks every 2 or 3 hours. Many little softwares will actually set off an alarm to tell you to take a stress break. Think of it of something like maybe reading, journaling, walking, meditating, singing, listening to music, maybe saying a prayer, taking a stretch break, reading, memorizing a scripture. Do it even if only for a few minutes. Invest in you. When I was a young husband, I often brought my stress from the practice home. And a mentor of mine, a dairy farmer, taught me to stop at a park on the way home and take a short walk to dump my stress in a nearby stream. And I've got to tell you, this simple technique allowed me to chunk my distress and not carry it home, where it was both noxious and obnoxious. Another prescription, set goals and priorities. Studies consistently show that people with clear goals outperform people with vague aspirations. Decide what God is calling you to do, what must get done, and what can wait. I believe you have exactly the right amount of time to do all that God has called you to do. However, you do not have enough time to do God's calling, as well as those things that are not God's calling for you. How about this prescription? Learn to say no to new tasks if they're putting you into overload, or if God is not clearly calling you to do them. One Christian counselor I really admire said this: in managing one's stress level, I would suggest to a client that before adding something to their plate, that they take a few minutes to write down how the additional activity would impact their schedule, their family's other activities, the overall rhythm of the home. And if they already have children's sports activities, Bible studies, how those responsibilities would be affected. It's a good exercise. Another prescription: note what you've accomplished at the end of the day, not what you've not been able to do. Stay connected with people who can provide emotional and other support. And to reduce stress, ask for help from your friends, family, from your faith community. Another prescription: spend more time reading. British researchers have shown us that reading is one of the most effective ways to overcome stress. It took the average person just 6 minutes to relax once they started turning pages, and it reduced stress levels 68%. What if you're not a reader? Well, here's a prescription. Consider exploring stress coping programs in your community or on the internet. And if none of these options help, seek the advice, the assistance of a trusted pastoral professional or Christian mental health expert. You know, God never promised us a comfortable life, but He does promise to comfort us in this life. Now, besides evaluating your stress, the second thing you need to evaluate in that sadness acrostic is your anxiety. And we all know what it's like to feel anxious. I mean, you remember the butterflies in your stomach before a first date or a big presentation, or maybe the tension you feel when someone's angry with you, the way your heart pounds when you're in danger. Anxiety in its most basic form, it's healthy. It's a normal response designed by our Creator to arouse us and to get us ready for action. And anxiety can prepare you physically and emotionally for a threatening situation. It can cause you to study harder for your exams or to keep you on your toes when you're giving a speech or teaching. Anxiety is designed both to help us cope and to assist us in performing at a higher level. But an anxiety disorder is a completely different matter. That disorder occurs when anxiety does the opposite of what it was designed to do. Instead of helping us cope, it prevents us from coping, and it dramatically disrupts our daily life. Anxiety disorders aren't just a case of bad nerves. They're an illness that often has roots in our biology and our biochemical makeup and our past experiences. And not surprisingly, anxiety disorders frequently run in families. For some who live with this disorder, the anxious feelings may be so uncomfortable that to avoid them, they have to stop most or even everyday activities. Others self-medicate with alcohol, drugs, or even frantic activities. And for others, panic attacks can occur so swiftly and strongly that they can result in experiences of terror, which completely immobilizes them. Of all the emotional health maladies, anxiety disorders are the most common and they're the most pervasive in the U.S. Nearly 40 million Americans experience an anxiety disorder in any given year. Now, there are several types of anxiety disorders. Each has its own distinct features and each has its own treatment. And many people, especially those with a religious conviction, believe people should be able to overcome the symptoms by sheer willpower or by more faithful observance or religious ritual or practice or prayer or what have you. However, for people with these disorders, this is simply not the case. But the good news is that effective new treatments are available. If you frequently experience anxiety, and even if you aren't sure whether you do or don't, there are several free, easy-to-use anxiety evaluation tools that allow you to check your oil level when it comes to anxiety. My favorite is the Zung Self-Rated Anxiety Scale. We've got a little URL there for you. The Hamilton Anxiety Rating Scale is excellent. And you can find a number of other anxiety rating tests that I recommend. They're all located at the tiny URL listed at the bottom of the screen. And the purpose of this program is not to discuss these specific anxiety disorders or their treatments, but rather to convince you that if your emotional will is not strong, you can strengthen it. And if you don't work to improve it, it's less likely you're going to become a healthier person. But I do want to briefly discuss the most common of the anxiety disorders. It's called generalized anxiety disorder, or GAD. And people with GAD worry at length about health, money, job, family, or work. Simply the thought of getting through the day provokes anxiety. They're unable to relax. They often have trouble falling asleep or staying asleep. Their worries are typically accompanied by physical symptoms like trembling or twitching or muscle tension or headaches, irritability, sweating, hot flashes. They can feel lightheaded or out of breath. They can feel nauseated or like they have to go to the bathroom frequently. They can have palpitations, even chest pain. Sometimes they feel as though they're being strangled or they have a lump in the throat. Other people can feel tired, have trouble concentrating, and sometimes even suffer depression. I want to tell you about one of my patients. On my first day of practice in the Smoky Mountains of Western North Carolina, he had classic GAD. He said, "I've always been a worrier. I worry about everything. I'm always keyed up, always on the go, Doc. I can't stop. It's like I'm unable to relax. At times, the spells come and go. At other times, it's with me all the time. These worrying and fretting spells can go on and on. I worry about things for days at a time, getting more and more nervous and uptight the more I think about it. I just can't let things go." And on top of that, he added, "I'm having terrible sleep problems. I get to thinking about things at bedtime and it's like my energy gets going. Other times I wake up in the middle of the night, get to thinking about things, and I get so wired up I can't go back to sleep. And sometimes when I'm having one of these spells, I feel lightheaded or like my heart starts racing or pounding, and that scares me to death, and it makes me worry even more. Doc," he said, "I need you to fix me. Check out my heart. Check out my thyroid. Something's going on here, and it ain't good." Well, it was important. I did check his heart, and I did a thorough screening of his blood, including his thyroid gland, only to discover that all of his tests were fine. But when I asked him to take an anxiety assessment questionnaire, just like I've recommended to you, his scores were through the roof, indicating a severe anxiety disorder. He didn't take it from me. He actually had to get a second medical opinion to accept the fact that all of his physical symptoms were from GAD. But once he came to understand it and to accept it, and he began a proper prescription medication for his prescription, and he received some basic counseling from a nearby psychologist, he showed dramatic improvement almost overnight. I suspect he could do even better if he would undergo some good, what we call cognitive behavioral therapy. That's another highly recommended treatment for GAD. but he didn't take my advice. Like many with GAD and other mental and emotional disorders for whom there is a stigma associated with seeing a counselor, he refused to seek further counseling. Nevertheless, with what he received, he did do well. But his 3 sons, also all of whom have GAD, did well with their treatments. Now, GAD usually comes on gradually. Most folks find that the symptoms start in childhood or adolescence, but it's not unusual for it to begin in adulthood or even in the senior years. GAD is more common in women than men and often occurs in relatives. And one clue that a person has this disorder is that he or she will spend 6 months worrying excessively about a number of everyday problems. So, if anxiety is negatively affecting you or those around you, consider seeing your family physician or a licensed pastoral professional or a Christian counselor. Most are experts at recommending that anxiety disorders should be treated with psychological therapy, pharmacotherapy, or a combination of both. They can help you sort that out. Now, most psychologists now believe that treating anxiety with what I mentioned earlier, cognitive behavioral therapy, is the therapy, the talk therapy with the highest evidence for effectiveness. And combining it with medication therapy sometimes is even better. So we've talked about stress, we've talked about anxiety. Let's talk about the third of the sadnesses, evaluating for depression. And after anxiety, depression is the second most common issue that can weaken emotional health and prevent people from staying highly healthy. It often accompanies anxiety disorders, and when it does, it should be treated along with anxiety. Now, depression is often accompanied by feelings of sadness, of apathy, of hopelessness. You can have changes in appetite, changes in your sleep. It makes it difficult to concentrate. I want to tell you a story about another one of my patients. She was in her late 60s and was the life of the small Presbyterian church in the town where I practiced. Her family had built that church. Her love, gifts, and prayers sustained it, but slowly she began drifting away. As the pastor and elders began to notice her absences, one of the elders commented, even when she's here, she's not really here. She seems distant. Now, several folks from the church went to her home to visit. She adamantly claimed she was fine. She just didn't feel like getting up as much. And now she was getting up in the years, she didn't feel like getting out as much. The pastor's wife insisted that she see a physician for a physical checkup, and he reported that she was physically fine. The exam and all the tests were normal. And after that, though, she disappeared from church. I mean, folks, they saw her once in a while at the grocery store, but when she saw them, she'd actually turn and go the other way. So I decided to go see her one day. I didn't know her, but I knew her neighbor well. I hadn't been in that small town of Bryson City, North Carolina, very long. In fact, I'd only been there a few months. But the neighbor was concerned. She told me, something's wrong with that woman. She always decorates her house and yard for Christmas, but not this year. She always bakes for the whole neighborhood during the holidays, but not this year. But worst of all, she always plants a garden, and this year she hadn't even tilled. Well, in that area, that was a big deal. So I decided to make a home visit. I knocked on her door. She opened it, but only a crack. She tried to be sociable, but I think she just wasn't up to it. But I could just tell something was wrong. She did let me in the house, and I sat and we began to visit. And I immediately knew the diagnosis. Why? I felt depressed. Being around a depressed person makes you feel depressed. I asked a few diagnostic questions. I'll show you a couple here in a minute. And she had trouble going to sleep, staying asleep. Her energy and motivation had got up and gone. Her concentration had vanished. She felt downhearted. She confided that she had thought about suicide. But she quickly added, I'd never do that. I love my kids and I love my grandkids too much. I explained to her the causes of depression and just how easily it could be treated. So she promised to make an appointment with me that week. She did. And within just a few days of starting a simple and inexpensive generic antidepressant and seeing a counselor or practice, her old self started to bloom. By the time her corn was knee-high, she was back to her normal self. According to the National Alliance of Mental Illness, when a person experiences 2 or more illnesses at the same time, those illnesses are called comorbid. In mental health, One of the more common comorbidities is that of depression and anxiety together. Some estimates show that 60% of those with anxiety will also have symptoms of depression. And the numbers are similar for those with depression also experiencing anxiety. Researchers tell us that much of what manifests as depression is caused by an imbalance in the hormones of the brain. Researchers tell us 37% of adults take medications that actually increase depression. And this can include some hormones, some blood pressure medicines, some medicines for heartburn. But regardless of the cause, most depression is treatable with a variety of treatments: antidepressant medications, dietary supplement, nutritional therapies, exercise, light therapy, pastoral counseling, or talk therapy, psychotherapy. In fact, up to 80% of those treated for depression show an improvement in their symptoms within days to weeks of beginning medication, talk therapy, support groups, or a combination of these treatments. But besides its high treatment success, nearly 2 out of 3 people suffering with depression do not seek or receive proper treatment. According to multiple studies, the combination of medication and talk therapy, psychotherapy, even a few sessions of counseling, seem to provide the quickest and most sustained response. Dr. Jerry Halverson says, quote, "Several meta-analyses of studies of the combination of psychotherapy and pharmacotherapy for patients with depression have documented an advantage of the combination treatment compared with either treatment alone." He adds this, "Combination therapy has also been associated with significantly higher rates of improvement in depressive symptoms, increased quality of life, better treatment compliance, especially when treatment is needed for longer than 3 months." Now, we family doctors, healthcare professionals also treat depression with diet and exercise. Many studies over the last 2 decades have found exercise is an effective treatment for depression. And some studies show that aerobic exercise can be as effective as antidepressant medication in treating mild to moderate depression. And with side effects such as improved health and weight management rather than medication side effects, it's a way to go for some people. Other research indicates exercise not only boosts your mood, but it also sharpens your memory, alleviates anxiety, helps you sleep better, increases your creativity and your productivity. In fact, one review of aerobic exercise in major depression recommends, quote, that patients participate in 3 to 5 exercise sessions per week for 30 to 45 minutes per session. Furthermore, the majority of research emphasizes that the exercise regimen should be continued for at least 10 to 16 weeks to achieve the greatest antidepressant effect. Folks, even a modest exercise program is an effective, robust treatment for patients with major depression, and the benefits are likely to endure, particularly among those who adopt it as a regular, ongoing life activity. Even resistance exercise training, like weightlifting, significantly reduces depressive symptoms among adults, regardless of health status. I mean, not only does exercise treat depression, but it may also prevent it. A report from 2019 concluded that physical activity can reduce the risk of depression. Just 15 minutes of vigorous physical activity or an hour of moderate exercise reduce the risk of depression by 26%. And researchers said there was also evidence that a lack of exercise may increase the risk of depression. Well, I mentioned nutrition, and what you eat may be as important as how you move when it comes to depression. A 2018 study found that people who follow a heart-healthy diet, it's called the DASH diet, the Dietary Approaches to Stop Hypertension. It's a diet that emphasizes fruits and vegetables along with low-fat and non-fat dairy, lean meats, avoiding foods high in salt and sugar. Also, people with that diet have a decreased chance of developing depression. And other studies suggest that people who follow a Mediterranean diet, which also emphasizes fruits, vegetables, fish, limits meat and dairy products, Mediterranean diet followers also have lower rates of depression. Even people with moderate to severe depression improve their mood, signs of depression by eating a more nutritious diet. The bottom line is this: the majority of people who suffer from depression can become healthier, even highly healthy. You don't have to put up with chronic or disabling depression. But first, you need to know if you have it or not. The United States Preventive Services Task Force and the American Academy of Family Physicians recommend screening for depression for all adults older than 18 years, regardless of risk factors. And they use what is called the Patient Health Questionnaire 2, PHQ-2 screening instrument. So here's the screening instrument, and there's 2 questions that you're going to answer. And the deal is, here, look in the upper left-hand corner, it says, over the past 2 weeks, how often have you been bothered by any of the following problems? And answer this honestly. So over the past 2 weeks, have you been bothered by little interest or pleasure in doing things? And over the past 2 weeks, have you been feeling down, depressed, or hopeless? Then for each one of those, if you said, yeah, I've had little interest or pleasure in doing things, is that not at all? Several days over the last 2 weeks, more than half the days over the last 2 weeks, or nearly every day? And you'd give yourself a score of 0, 1, 2, or 3. Same thing on feeling down, depressed, or hopeless. If not at all in the last 2 weeks, that's a 0. Several days is a 1, more than half the days is a 2, nearly every day is a 3. You add it up. And a score of 3 or more is considered a positive result. And it means that you should take a more detailed questionnaire. It's called the PHQ-9. And we've got the little tiny URL on the screen where you can find that. But if you're positive on either of those screens, then you need to have a visit with your family doctor. These self-evaluation skills for depression, they're designed to help you determine if you should see a licensed pastor or a licensed healthcare professional about your feelings. They're screening tests only and should never be replaced by your family doctor, a mental health professional, or a pastoral professional. I like this. I think of it this way. Some Christian psychiatrists say mental health is both biochemical and may need help through diet and medication. Psychological health is emotional and may need help through exercise, fresh air, and counseling, whereas spiritual health needs pastoral care and God. And in my experience, most of my patients can benefit from all 3. Now, if you missed any of those URLs, all those websites, don't worry about it, because I'm going to help you save time, because there's one test that will allow you to test for stress, anxiety, and depression all at one time. And that's the website located at the bottom of your screen. This and the other tools we reviewed, which can help you determine which, if any, sadnesses you might be wrestling with, can be so helpful in seeing where your mental health will, your emotional health will is. According to Reverend Samuel Rodriguez, president of the National Hispanic Christian Leadership Conference, quote, Christians struggle with depression and even suicidal thoughts. It does not make you less of a Christian. Just like heart disease or cancer does not dilute your Christianity, neither does mental illness. Reverend Rodriguez wisely adds, suffering from mental illness is not a sin, yet not addressing it may very well be. At the very least, it's a lost opportunity to improve your health and happiness. Well, we're going to have more tips for you in each of these areas in future shows. But next time, I want to continue our examination of the 10 essentials of healthy, happy people. We have 7 more to cover, and I'd love you to vote on which one you want me to talk about next. Just drop me an email at drwalt@liftable.tv and let me know your next choice. So in review, here's what we've covered: the essential of true health, the essential of self-care, and the essential of reducing sadness. So which would you like me to talk about next? The essential of forgiveness, or the essential of relationships, the essential of well-being, or of positive self-image, or discovering your destiny, or of personal responsibility and empowerment, or of building your healthcare team? Again, just drop me an email at drwalt@liftable.tv and let me know your next choice and any other questions you have, about your health or your family's health. But I've got to give you a warning. I can't answer specific questions about your individual health, but I bet you have plenty of great questions to ask me. So send them in and we'll get to as many as we can during future programs. In addition, you can read more about these 10 essentials in 2 of my books that you can find on my website, drwalt.com. One is Fit Over 50, and if you're 30 or 40, this book's still great for you. And the other is 10 Essentials of Happy, Healthy People. Well, don't forget to vote on our next program, and until our next visit, let's get moving together towards true health. And dear friends, I pray that you may enjoy good health and that it may go well with you, even as your soul is getting along well. I'm Dr. Walt. We'll see you back next time.